So moving on to our next video, now I'm going to go over the pre-op checklist. I'm also going to be doing some teaching and preparing my patient for surgery. So in this video, again, I'm just going to start over. I'm going to identify myself to the patient and identify the patient. He's going to verbalize to me his name is Jamie Carson. I'm matching his ID bracelet up against my doctor's orders and my MAR, making sure that I've got the right patient. So I know my patient's going to be going down for a laparoscopic appendectomy. Consents have been signed. My laparoscopic appendectomy consents. I'm super excited because I actually found one online, but okay, oh my God. So first and foremost, I'm going to make sure my patient has done their HIPAA bath. He's already done it. I gave him the supplies already and he was able to get himself cleaned up and prep his skin for surgery. And I'm using this pre-op checklist here, and I also got another pre-op checklist that was a little bit more thorough that I can use when sending my patient down to the OR, and it's got signed. So my H&P is already completed and it's in the chart, ready to go down. My patient's been NPO. We set him at NPO. His diet was set at NPO at 6 a.m. It is now 12. So the patient's been NPO for about 6 hours now, but he also states that he hasn't had anything to eat or drink prior to coming into the ER. So that time included. He's had his skin prep. He's already done the HIPAA bath. Consents are signed. He's voided prior to transfer. Prior to him going down to the OR, he's gonna go ahead and get a Foley catheter placed. He's also gonna have an NG tube, so that'll take care of the voiding. Pre-op meds, prior to him going to the OR, he's gonna have some Dilaudid. He's also gonna have some insulin, and those are his meds that he's gonna have going to the OR, and they're also gonna be charted and given to him before he goes down. During transport, he's gonna have all bed rails up. This is my patient's hospital gown. He's in the gown. He's all ready to go down. He's got his ID band on. He doesn't have any allergies, so he doesn't have an allergy band. He doesn't have any dentures, eyeglasses, or hearing aids, so we don't have to worry about that. He doesn't wear any makeup or nail polish. Vital signs were taken. He's got a blood pressure of 140/80. His pulse was 80. Respiratory rate was 18. His O2 sats were at 98% on room air, and he had a temperature of 99.2. That was all taken prior to him going down to the OR. On this pre-op checklist, I was able, there's spaces where I can write the vital signs down. I wrote them in initial next to it. I also stated here, it asked whether the patient was NPO or not. The patient was NPO, and I put the time that we got the order for NPO, which was at 6 a.m. when he came into the OR. Here it also asks if the allergies were checked, allergy bracelets on, an allergy sticker on the chart. I signed and initialed that. He does not have any allergies. He's got his ID bracelet on. He's not on any type of isolation. Everything else is left in his room. He's hit my nursing assessment. It's going to be attached to the chart. The consents are attached to the chart. His MAR is attached to the chart. Here's an example of his MAR. That's going to be attached to the front of the chart. And he's going to be able to go down to surgery. And that is when I would go over my pre-op checklist. Now, I would also go over my teaching with the patient. So I'm letting the patient know that he's getting an appendectomy, a laparoscopic appendectomy, which is going to consist of his appendix being removed because he's had some appendicitis, which is where the right lower quadrant pain that he's been having is coming from. From the surgery, I can go ahead and teach him about what to do post-op, what to do after the surgery. So I can teach him the use of the intensive spirometer, how he should be using that to help with breathing exercises. And I can also teach him about splinting to help with the pain, or the log rolls, how to splint using the pillow, holding it up against his abdomen of the surgical site when he's coughing or moving at all. And I would do all of that in my that'll be all part of my pre-op checklist. I can also, if he's feeling nervous about the surgery, I can, excuse me. If he's feeling nervous about the surgery, I can go ahead and, try to calm his anxiety. I would also give him his medications, calm the anxiety, just to, reassure him that everything's going to be okay. Try to give him a better idea of what the surgery is going to consist of. And then I would go over the consent with him. If he has any questions, the consent usually is signed by the patient, a witness, and the doctor. So I know that I can tell my patient that from the surgery, his abdominal pain is going to be relieved, hopefully. And while it's an open and effective treatment, sometimes the symptoms may still remain. You have to go over all of the benefits and the risk of the patient. And this is just covering what's on the consent. I can go over the consent with him, even though the physician would do that. He's going to be getting a laparoscopic appendectomy, which is where they use a small camera and they're going to insert it into the abdominal cavity, where the physician can view and remove the appendix via multiple small incisions. So instead of it being a huge open laceration, there's going to be about 3 tiny little incisions placed. And this is all information that I'm going to be relaying to my patient. I would also let them know the risk of the surgery, so they could risk infection, bleeding, injury to other internal structures, and different injuries I can go over. So my patient states by them signing this, they are consenting to the surgery and consenting to everything that the physician and myself has gone over about the surgery. And my patient has already signed it, I've signed it, and the physician has signed it. So that will be placed in the chart and sent down with him to surgery. And